Great. Well, that was a terrific discussion with Secretary Carson and BPC President Jason Grimay. We want to move to our second panel now. We're very pleased to continue this conversation with three experts in healthcare as well as housing. I think there was a link up there to the full bios of our second panel, but I want to just very, very briefly introduce them. We have Eileen Fitzgerald here, who is the President and CEO of Stewards of Affordable Housing for the Future, or SAFE. Ms. Fitzgerald has over 25 years of experience in housing and community development and previously served as CEO and COO of NeighborWorks America. Next to Eileen, we have Dr. Don Moulds, who is Executive Vice President for Programs at the Commonwealth Fund. Prior to joining the fund, Dr. Moulds was Acting Assistant Secretary for Planning and Evaluation at Health and Human Services, where he served as Principal Policy Advisor to Secretary Kathleen Sebelius. And next to Don, we have Dr. Samuel Ross, who is the Chief Executive Officer for Bon Secours Baltimore Health System and is the market leader for Bon Secours Kentucky Health System. Dr. Ross previously worked at Parkland Health and Hospital System, Dallas, Texas, where he served as Executive Vice President and Chief Medical Officer. Eileen, Don, and Sam, welcome to the Bipartisan Policy Center. Thanks so much for being here. And maybe I might start actually with Don. Don and I work together at Health and Human Services, and Don.
Of disclosure.
What's that?
I said in the interest of disclosure.
Yes, yeah, in the interest of disclosure. That's right. And Don also served on the advisory group for BPC's most recent paper, which you have in front of you. And Don, I mean, you were there at Health and Human Services. One of the important recommendations, I think, in BPC's report is that the secretaries, we just heard from Secretary Carson, the HUD and HHS ought to be meeting on a regular basis, designating departmental liaisons or offices with adequate resources to ensure there's departmental collaboration. I mean, you were there at HHS. You know, how does this work? How should this work? How important is this? And what advice do you have for this partnership between HUD and HHS in the current administration?
Sure. Well, first, thanks for having me. I'm honored and thrilled to be here, and it's a great conversation leading up to this one. So I was the lead at HHS on what turned into a formal collaboration between the two agencies, and involved from time to time the Department of Education as well. It came out of a famous lunch between my boss, Secretary Sebelius, and Secretary Donovan at HUD, and they got together, came to the same conclusion that I think secretaries before them have come to, and it sounds like Secretary Carson has come to, which is there's a lot of good that can be done between the two agencies. So there's just a lot of overlap with the mission, and the BPC report, I think, does a really terrific job of articulating a lot of those key issues. There was a person on the HUD side at a high political level who was designated as the lead there. We had a conversation every week. We met in person a good amount. When we couldn't meet in person, we had a call. We did that the entire time I was at HHS, which was sort of a remarkable thing. And we convened work groups among the career folks who were working on the issues that we were trying to tackle. And I think really meeting at all of those levels is critical. The other thing I will say that was, so of all the things that we did, I think the most meaningful was that we got out and we visited some of the folks on the ground who are doing the work, supporting the populations that were part of our mission, and that was really powerful. So I remember vividly going to Seattle with Fred Karnas, who was my counterpart at the time at HUD, visiting a supportive housing non-governmental agency, a community agency, doing incredibly meaningful work, essentially housing formerly chronically homeless individuals, so individuals who spent most of any given year on the streets who had high incidence of severe mental illness, schizophrenia, bipolar disorder, addiction, and we're housing them at close to perfect rate. So almost everybody that they were bringing in, they had housed successfully for over a year. So they had almost no attrition. The substance use issues went down. Medication adherence was very high. Their intersection with emergency rooms went down. They weren't spending a lot of time in institutions like jails or prisons anymore. So really powerful. And the first thing that we heard when we visited them was, we have somebody on staff, we have a number of people on staff and spend about 30 cents on the dollar. The dollar's coming in by way of grants from your two agencies, writing for your two agencies because you don't coordinate. And so they're really important things that you need to hear. And the problems that you need to work on, I think, come alive when you go out and meet the people in the field doing the work. So, those are some of the things that I have to say, we made some progress. I was disappointed in the amount of progress we made. I think if I had to hazard a guess, there is still a conversation about what you can and can't do through regulatorily to merge HHS and HUD data. There are questions about single grant applications, which you would think is something that you might be able to do with the snap of a finger. But it all starts with conversations.
It's great. Very helpful insights, both process steps and on the ground. And Eileen, your members are on the ground. Your reach is pretty impressive. Members own over 130,000 affordable rental homes across the country. To what extent have your members bought into utilizing housing as a platform for health, and what are some of the innovative examples around the country where your members are really buying into health and wellness?
So, I wanted to just mention that before we even get to housing as a platform, there's just housing as health. And I think it's just incredibly important to realize that. And Secretary Carson talked about prevention. I mean, we know that the biggest prevention is to increase the supply of quality, affordable rental housing. We just don't have, at multiple levels, local, state, and federal, the will to get there. But that is going to be the most impactful thing we can do.
Housing is health. Right?
Housing is health, right. But using housing as a platform, I think there's kind of three ways that we think about that. One is increasing access to health care, and that might be insurance, transportation, bringing health care on site. A second is, how are we of value to the healthcare system, which is things like reducing ER visits, hospital readmissions. And the third is really addressing the social determinants of health. So in addition to housing, which is obviously the most important social determinant of health, such as food insecurity, education, employment, financial stability, community safety, and social cohesion. So we see housing as a platform doing all three of those. I think the first two are often the things that are focused on in health, and we think that that third piece of social determinants of health, if we're thinking about 2048, that's what really matters, because that's about not creating a pipeline of people with chronic diseases, right? But the challenges in a budgetary environment, a society where we think such short term, we often underinvest in that piece. But a few examples, Volunteers of America and Mercy Housing, who are two of our leaders in how they think about health and housing, have worked with Colorado Access to bring a care coordinator on site. It's being paid for by Colorado Access, and that's to work with residents to really make sure that they are accessing the healthcare system, have a healthcare team, and then bringing some education and services about improving health on site. And that the big kind of push and innovative push there was that Colorado Access is paying for it. Now that took about 2.5 years to just get that conversation finished, to get a pilot going. So it's a great example, but there's a ton of time invested in that. We just talked about homelessness. Many of our members run supportive housing, and obviously that's one of kind of the clearest examples of how you combine housing and health, and how you can, with good case management and good services, really reduce ER visits, readmissions, and most importantly, significantly improve the quality of life for the residents. In senior properties, this is a huge potential, and one that I was really excited to see some things highlighted in the report. But the first piece is just increasing access. So National Church Residences has a place in a property in Pittsburgh. I think that they were able to actually bring an on-site medical facility on the property. But there is numerous examples of making sure that residents have access. Sometimes that's as simple as how do they get there? How, what's the transportation options there? And there's some really interesting things what's happening with Uber and Lyft related to that. Other times, it might be in a place. I remember being at a property where the residents could not access a podiatrist. That's a huge thing for a lot of seniors, right? And being able to bring that. So it's sometimes kind of as straightforward as that. A few of the SAFE members are participating in the I Wish pilot. And I know there's a couple folks from Leading Age. I wanted to call them out, and the Lewin Group for the great work they did on really creating the momentum for this pilot, which combines a wellness nurse. And I know that some just really initial responses and anecdotal reports have been that there's a significant improvement in the outcomes of those seniors. And again, most importantly, they're aging in place, and they are not using nursing home beds. So that is saving all of us a lot of money. So we look forward to more of that report. And we also have a couple of examples for families. Again, we see this less, but the community builders worked with Rush Hospital in Chicago to bring a nurse practitioner community clinic on site of a very large property where folks, they knew they were having a lot of issues of children and families accessing health care. And this can be as simple as, vaccinations and going to a much higher level. Mercy Housing piloted telemedicine in Atlanta for families. And this one, I think, is something that folks don't think about. You're thinking about telemedicine in a rural context or in a very isolated community. But, families who are working hourly jobs in this crazy economy we have where they don't even have set schedules, when they have to take their kid to a doctor, that often means missing work and sometimes getting fired. So they're at that choice between taking their kid to the doctor and that. So how we improve that access, how we break down those barriers in healthcare, that telemedicine project was looking at that. But that social determinant of health piece, one simple example is food security. How we can spend hours and hours talking about health and not think about the fact that we know that so many people don't have healthy food, nutritious food, or just get what they need per day. So our resident services folks have just reported that is probably the thing they worry about the most. And mind you, these are residents who are living in subsidized housing. So they're not maybe having as many issues about this as folks, down the block or not. But in that case, some members like Mercy Housing tried to actually bring an on-site food pantry to as many properties as possible. Others, obviously, things like Meals on Wheels. Community gardens can be great when they're really actively managed, but it also can be working with the neighborhood to really think about how to attract healthy food. And as we see a lot of redevelopment and some of the RAD redevelopment, some of the choice neighborhoods work, what we want is to bring that food to the neighborhood. So those are just a few examples.
That's great. Sam, I want to bring you into this discussion. Healthcare has a role here, and you all at Bon Secours are making a tremendous impact when it comes to community development. You're taking community benefit very, very seriously. When people ask you the question, why is a healthcare system investing in affordable housing, what answer do you give them? Can you talk about what the system is doing there and why they're doing it? And if you have any results to demonstrate that these investments are improving some of the metrics that we want to see, whether it's better health outcomes or reductions in preventable healthcare costs.
All right, thank you. And thanks for the invitation to be here. And for the next 20 minutes, I will be explaining this. Just kidding. So you referred to us earlier on as experts. And I would just flip that, because I think what we all would acknowledge is that when we engage the community, then we understand who the real experts are. And that the solutions to a lot of things, whether it's HUD or HHS or others are trying to address, really lie in our community engagement activities. So Bon Secours, has been in West Baltimore for over 135 years. When the sisters came from Paris with really what was the earliest form of visiting nurses, because they went into the homes and they did what was necessary to care not just for the patient, but also the family members. And so they've continued to do that as part of their charism of healing, compassion, and liberation. And then our mission is about good help to those in need, especially the poor and the dying. And that's been carried out not just for the hospital, because the hospital was established 40 years after the sisters arrived in West Baltimore. But they've continued to say, what is the need and what does the community identify as a need? So our why is really our mission. It's the following of Catholic social teaching, which is about the dignity, the respect that human beings deserve, the common good, and the justice. So that's been manifested by us in the fact that we are a 70-bed hospital facility in West Baltimore, but we have over 800 affordable housing units. So we flipped this already in the face of healthcare reform, and we've been doing this since the mid-90s. So if people want to see it in action, I invite everybody to come to West Baltimore. Don't believe what you see on TV and all that stuff. We'll get you in and out safely, not a problem. But our mission is the why for our investments. Necessity is why. And that necessity is about embracing our role as an anchor institution. And I think the opportunity that most healthcare systems have is to realize that we typically are the largest employer. We typically are the largest economic engine. We've looked at studies that show we contribute over $200 million annually to the city around investments and economic activities. And then the third, the mission, necessity, and the third is the community engagement piece. Because we got into housing, back in the mid-90s, because when people went out and talked to the community as to what their issues were, they didn't list high blood pressure, heart disease, diabetes, cancer as their priorities. The famous phrase in West Baltimore is that after community prioritization, the community said, our problem is rats and trash. And that phrase has persisted, to this day. And so we embrace that, and in healthcare, we often contact a person, an individual, and our question is, well, what's the matter with you in a healthcare sense? And in this world, in this environment, we got to flip that question to what matters to you. And in so asking it that way, that's where we got to the rats and trash, which led us to the reasons for the rats and trash were so many boarded up vacant buildings that needed to be renovated. And so that was our entry into housing. And not because we wanted to be what we are as the largest developer in West Baltimore. We develop in partnership with Enterprise Foundation. We do most of it through low-income housing tax credits. But we're there because we are what we would call community responsive, which is caring for the health of the community beyond what most health systems see as a traditional approach.
That's great. Thank you. And we'll come back to your advice for other healthcare leaders. Don, I want to come back to you now, being at Commonwealth Fund. What's the role of philanthropy here in more tightly connecting health and housing programs and informing policymakers about opportunities for collaboration?
Sure. So, I think when I think about answering that question, I think it's helpful to think about the space that government occupies and the space that philanthropy occupies. First big difference, and I say this with love and having spent most of my life in government service, government often is not quick to fund or to seize an opportunity, and philanthropy can be. So if there's something innovative on the ground that you want to you want to seed and watch and study, you can do that very quickly in the philanthropic space. We spend a lot of time at the Commonwealth Fund right now thinking about health and housing and the possibility of health systems investing in housing as a health solution. So, when I was at ASPE, we spent a lot of time looking at the case for housing as a health intervention. But the problem in government is that there have been since I started working on this problem, at best, flat budgets on housing budgets, which means that if you're going to create a housing unit, you have to take it away from somebody else. So it may well be that you're going to save some money by taking a housing unit away from a poor family and giving it to a chronically ill veteran who lives on the streets. But you've done something bad to do something that is maybe marginally better, maybe not, right? So we've been spending a lot of time thinking about health systems that bear risk for the people that they serve, making these kinds of investments as a business decision. And that's the kind of thing that's very hard to explore on the governmental side. My view, for what it's worth, unsolicited, is that it's a second best solution. Anytime you medicalize something, you're not making it any cheaper, and there's a certain inefficiency to asking people whose jobs are to see 25 patients a day or however many to tackle some of these issues and learn more about them and to learn referral patterns and so forth. But it's certainly better than doing nothing about the problem. So we spend a lot of time these days thinking about that as well.
Great. Thank you. Eileen, I want to touch on one of the recommendations in BPC's recent report, which talked about the need to integrate housing and behavioral health. We're in the midst of an opioid epidemic now. There are millions of Americans with severe or severely mentally ill. How do we integrate housing and behavioral health to provide a better platform for treatment as well as recovery? And have any of SAFE's members tried to tackle this and connect individuals who are residing in these properties, if they do have behavioral health conditions, to the services that they need?
Yeah, I was so excited that you guys were starting to surface this. And, obviously we have a bigger issue of just people not having access to mental health, insurance not covering mental health. So, that's way beyond my expertise, but I think that is a core problem. There is 3 quick examples, and these are kind of more at a base level. I think as we get to severe mental illness, the role is really just to make sure there's a place to refer to, right? So we need to make sure housers do what housers can do. But we have kind of 2 examples of interesting things in family properties, both actually in choice neighborhoods, where I think getting back to the rats and trash, it really is about listening, like what's the issue? And through different community conversations came up that people felt like there was not issues to any kind of mental health access, and that pushed our members to think about partnerships. In Chicago, in the Choice neighborhood in Woodlawn, POA, after some kind of rough starts, found a really great mental health provider, SGA, who has come in, and they have really done a lot of kind of what I would call peer groups, using other things like painting or woodworking or quilting or sewing or book clubs or whatever it might be, to actually create an environment to have behavioral health conversations. And their staff have facilitated those. They have seen, for the lots of folks who have participated in this, a reduction to only 3% of people being referred out when that referral rate was much higher. It also, because of the way they've done it, it's addressed some of the potential stigma issues that people in certain communities are saying, I don't need therapy, I don't need to do that. But it is getting to the underlying stress and trauma faced by people who live in poverty every single day and have grown up in poverty, and how do we do that? So we think that's really promising. Their big learning is you got to find the right partner. Mercy has worked with a school system in Sacramento, really interesting example, and brought a mental health navigator that is working with both the school system and the community. Again, in an area where stigma is really big and nobody wants to talk about mental health. This has been is probably more about reducing that stigma and facilitating access to the Sacramento mental health pieces, services, which wasn't happening before. So I think, the reflection to that, to the opioid is, how are you creating a culture in the place you live that says this is allowable, this is okay, and actually getting it above board. And then the other one, in senior properties, this is something that obviously folks have dealt with for years and a whole different level, but one of our members at NHP Foundation, along with others, has been doing some work with AARP around Alexa. This was really started to just think, how do you do quick resident services connections? What they found is it's really having some impact on social isolation. So I think on the social isolation issues and how we think about those, again, we're touching the surface, but that is an underlying issue.
It's great. We had a forum actually yesterday morning with Senator Bill Frist and Tivity Health, the CEO. They were talking actually about social isolation, and this is not a touchy-feely concept. This is directly related to heart disease, stroke, dementia, as well as increased healthcare costs. So very important issues. Thank you for that. Maybe Sam, one last question, and I do want to open it up to the room. You talk to C-suite executives in the healthcare sector probably all the time, or more than any of us. What advice do you have for healthcare leaders, the CEOs of health systems, of payers, provider groups? How should they engage on housing-related issues? And do you think, I'm sort of leading on to this question because I do think this is the case, but how does this align with system-based, value-based healthcare transformation efforts? That's the talk of healthcare. We're taking baby steps, some would say. But as value-based healthcare transformation proceeds, how does this fit in, this sort of health housing integration?
Okay. And I do want to touch quickly on the second part of the first question you asked me was about data, because we get asked about that all the time. And we don't have a lot of longitudinal data, but we do know that by connecting our housing tenants to resources, that we do see those outcomes. So we know that behavioral health screening has already been mentioned at our housing facilities. It helps us to identify folks who have housing needs. And we have a lot of outreach programs that allow us to connect. Like 85% of those people we see in an outreach setting, within a couple of years in the program, we make sure we've addressed their housing insufficiency needs. So all of these things fit together and give us transactional data at this point in time, but we really are still trying to get to that transformational component. But to your current question about my colleagues, Secretary Carson, talked about how do we create hope. And as leaders, and particularly as CEOs and leaders of institutions, that's our role. I see my colleague Rosalind Brock out there. She's heard me say this. St. Augustine said, hope has two beautiful daughters, it's courage and anger. And it's anger at the way things are, and then courage to really do something about it. And so what I always challenge my colleagues and others to do is really adopt those principles, because we know that from a justice perspective, this isn't right. And so first of all, just acknowledge that there is a problem, and that as a leader of an anchor institution, that you have a responsibility and obligation to do more than just what's within your walls of that institution. And the second thing we remind people of, most of us in nonprofit settings have to do a community health needs assessment.
Yep. Every 3 years, yep.
And then we also have data that comes from our health departments, whether that's local health departments or state health departments, that tell us where our problems are, where our challenges are. And that also includes the community engagement piece as we follow through with that. And then the third thing I say is identify the partners, because we've been fortunate in how we've been able to do this with partnerships, whether it's been with, I mentioned Enterprise, the state housing departments, the city housing departments, and most recently with Kaiser Foundation, where we have an initiative called Future Baltimore in West Baltimore, where they've engaged with us and have long-term commitments to how we change health outcomes in West Baltimore. And then as it relates to the transformation piece, I can tell you over these years, what we've been able to show, particularly in West Baltimore, is by having these programs, housing and community engagement. We have a program called Community Works, as I heard the Secretary talk about an Envision Center. What we have is Envision Center for the last 20 years in West Baltimore. It's called Community Works. So if he or others want to come see that, again, we'll get you in safely and out safely. Come see that as an example of how those resources are brought to bear on the individuals that we also provide housing for. So we've been able to show that by having increased access to primary care, we're reducing those potentially avoidable utilization incidents, that we're reducing emergency department visits, that we're increasing access to behavioral health services and programs. And so it does tie to the incentives and the penalties that we all have in healthcare. And we've been able to demonstrate in West Baltimore that that has made a difference, particularly under our model in Maryland of global budget revenue.
Yep. Yeah, that's great. And Sam mentioned Kaiser is an excellent example. They recently announced a $200 million investment in affordable housing. Kaiser
Right.
Health System, one of the largest nonprofit health systems in the country.
And we have already applied for some of those dollars.
Right. All right. Great. Great. Well, let's just stop here, and maybe we'll open it up to the audience now. Very much interactive here. So if you have questions, please raise your hand. We have roaming mics. We'll get you a microphone. Please introduce yourself and ask your question. So. Looks like we have one in the front and one in the back. Yeah, that's great.
Good morning. Stacy Bridges with Veterans Vision. You said rats and garbage were the biggest problems in Baltimore. Is there anything that HUD is doing as far as purchasing these vacant places and fixing them up, and that would create jobs and training, more housing, and probably help with health care as well, because once people have a place to stay, they have security, and if security means less health problems. So are you guys teaming up with HUD and making sure that no one slips through those cracks?
We would love to do that. The interaction with HUD and a lot of other agencies really happens when we do a development. And it's primarily through, I mentioned, the low-income housing tax credits. That whole application process and then the whole development process brings in city and state and federal resources, and HUD is a component of that. But is HUD directly taking the lead on creating anything like that? And the answer is no. We've had some conversations, particularly because of the Envision Center concept that they've brought to West Baltimore, but early in its infancy, and not a lot of traction at this point in time.
And I would just say that, those are private, so the most important thing is to get more resources so that, mission-oriented developers, nonprofit or for-profit can do that. Or also for some of those homes, Ruth Ann Norton here is with Green and Healthy Homes, they've done a lot of work in Baltimore about those homes that can be saved and how to make those healthier places. But, none of this, it all requires. So HUD's role is to facilitate financing. We probably don't want HUD actually buying them up, but there's lots of partners on the ground who can do that good work.
Great. Question in the back? Yep.
Hi, I'm an intern this summer at the National Center for Health Research, but also a student at UC Berkeley, which means I've spent the past 3 years kind of living in Alameda County and Oakland, and I'm seeing a lot of the same issues in these areas that you guys have discussed. And you guys seem to be doing a lot of really great work. But one of the things I've noticed in Alameda County where there is a lot of similar programs is that we have an amazing bank of resources and that a lot of amazing work is being done, but the issues still continue to persist. And so I'm wondering, what can we do to make a more systemic change that actually impacts and creates long-lasting change that isn't reliant on just like nonprofits doing small-scale work?
So you're both the housing and the coordination. Yeah, so California last year passed a really kind of groundbreaking housing bill and there'll be a housing bond, which you should encourage your friends and colleagues to vote for this fall, but it was tremendous. One of the big issues in California, as in many states, is actually kind of local zoning, land use, and permitting, and it's probably gone to a new level in California. So there is some pieces of that legislation that are trying to kind of break some of that down and fast track it. In the Bay Area, there's just huge density issues. And so there's a lot of, and there's this whole YIMBY effort starting the Bay Area of yes in my backyard as opposed to no in my backyard. But, Berkeley and Oakland, folks don't necessarily want a lot more density. There's a challenge when you have a lot of people. There's accessory apartments issues. So there's a lot of interesting things, but much of it is both, getting some resources statewide and breaking down those local land use and zoning and permitting barriers.
It's also just a real shortage of affordable housing stock, and
Right.
so California is a great example that has done many things right in this space, but doesn't have sufficient affordable housing stock, and there's only so much you can do if you don't have it.
Right. So what's in those, the land use and the bond, is all trying to create
Right.
more stock.
And the other thing from a process issue I would add, because 20 plus years ago, what really helped in West Baltimore was a coalition that formed called Operation Reach Out Southwest. And these were 13 neighborhood associations. Bon Secours' role was really as the convener. And that's why the importance of the anchor institution is really highlighted. So now you fast forward to the current environment, and there's an organization now called Southwest Partnership. So it's extended beyond our first little area all the way down to the University of Maryland at Baltimore and other neighborhood associations. But in so doing, we brought more people into the discussion. So there are other foundations that are now involved in the discussions, along with city, along with the state. And the state has helped a lot with decreasing blight, because the governor allocated, $75 million a couple of years ago to the city of Baltimore for the sole purpose of tearing down vacant buildings and doing, deconstruction, with the idea that hopefully developers will come in and bring more affordable housing units in partnership with the city and the state.
There's also a very interesting regional effort to use the land around BART, which is controlled kind of more broadly in the Bay Area, to try to, more quickly increase stock.
Great. Question right here. Yeah, 2 questions. And then we have one over here. Yeah, so. Great.
Hi, my name is Jenna Shelton. I'm with BPC as well. And I was just wondering how you can balance supporting community development and also affordable housing without contributing to the issue of gentrification.
Wants to take that one?
Yeah, what is gentrification? It's such a fine line, right? I mean, we would say every person deserves to live in a vibrant community, and some elements of gentrification contribute to vibrancy. I think it is some longer-term planning, really thinking about how you preserve affordability. DC, for example, has TOPA, which is tenants' right of, to purchase. That's a good example of a kind of anti-gentrification strategy. Really investing kind of both local and state governments being strategic to make sure, as they start to see movement in communities, that they are investing in affordable housing, providing that financing, whether it's tax credits, but everyone has a different version, and obviously how you engage the community and tenant voice. But I think it's mostly thinking about preserving that income, and you have to do that upfront and thoughtfully.
And it gets to leadership and political will as well, because in Baltimore, there's 2 forms of community transformation that have taken place. One on the east side, around Johns Hopkins, that caused a lot of community consternation even before I arrived there, because the perception was you were displacing people in order to revitalize the community, as opposed to what we've primarily done on the west side is to do it with people in place. And so how do you get the entire community to elevate, to have that reinvestment into housing, redeveloping existing housing and new housing where it's appropriate. But it's a philosophy that, again, in West Baltimore is being driven by the Southwest Partnership and others to do it that way, as opposed to gentrification in a broad way. But to her point, to Eileen's point, yeah, gentrification still occurs to a limited degree in West Baltimore, but it's really more of the doing it with people in place, the place-based strategy on that side.
Great. Question all the way in the back.
Great, thank you. J.R. Denson with the American Council for Energy Efficient Economy. Say that 3 times fast. I'm curious, particularly for Dr. Ross, Bon-Secours, you mentioned some housing rehabilitation and health outcomes of the folks who live in those houses and some data you're collecting around that. Is that data publicly available, and can you maybe speak a little bit about kind of what results you're seeing out of that work?
Right. There's not a lot that's publicly available because currently we're partnering with Morgan State University in one of their research arms to do that in more detail. We have a lot of, like I said, transactional data where we know how many people we've seen and what those specific interventions have. But we really want to get to the point that, after 2 years of being in our programs, where are you? Or 2 years of employment, have you moved out of home renting to home ownership and those kinds of things. So we still have a ways to go. We're really getting that kind of information.
Probably have time just for, we'll take these two as last questions. Yeah, so get some microphones in front. I think there's one question here and one question here. Yeah.
Hello, Kayla Lumpkin with Quicken Loans. I'm a government relations intern, and I had a question primarily for Dr. Ross. I think there are a lot of similarities between the issues that Detroit and West Baltimore face in terms of eliminating blight and also development division between east and west side of the city. And I was wondering if you could go into more detail about the initial issues that the Community Works Center faced when it first started.
Yeah, what I mentioned, Community Works started over 20 years ago, and it grew out of the Operation Reach Out Southwest initiative. So what that organization did was actually create a 20-year plan for how they wanted to see revitalization and just to really say by 2018, West Baltimore would be a vibrant community. Now, we're in 2018 and didn't quite get there. But what has happened with Community Works, those programs and services that evolved there, which I said were similar to an Envision Center, grew out of that community input. So they said they wanted child care. So we have a child development center there. They said they wanted programs around teen pregnancy. So we have programs that engage those teen mothers. I went to a graduation just a couple of weeks ago. So they teach them not only parenting skills, but if they haven't finished high school, they have access to GED. Or if they have finished high school, we still encourage them to go on, to higher education. We have workforce development programs because, again, a lot of the 18 to 24-year-olds there don't have employment. We have the worst unemployment rates in West Baltimore. We have a reentry program there because the largest number of individuals in the Maryland correctional system come from our primary and secondary zip codes. So we have a program for men and for women that we go into the prison prior to their release, make those initial interactions, and the day they're released, we pick them up from the correctional facility and begin a 12-week program at Community Works to reintroduce them to society. Many don't have GED. We teach fatherhood initiative. We teach parenting skills, so on and so forth. So all of our programs there grew out of community engagement, and what the community said was essential to really making all boats, begin to rise in West Baltimore.
I think we'll do one last question. We're out of time, but just let's make it
last question.
quick.
I really appreciate it. I was wondering, what are you doing for the homeowners, the people who do actually own the properties that are vacant or in need of repair? How do they get access to, like, the National Housing Act, the same loans that Sean Hannity got access to fix up those buildings? How can they get access? How can the poor little widow get that help to, fix her bathroom or to update her house and so forth?
So, often those are it would be different across the country. Sometimes local jurisdictions, cities or counties might be a lead on that. In some cases, it's nonprofit organizations who run those. And as you know, I mentioned GHHI before. I think part of the challenge is if it's a loan, does somebody have money to repay it, right? Mm-hmm. So on the senior side, often you just can't there's just not enough money, so somebody needs a grant. And the kind of, we brought up the challenges of Medicaid before in, paying for some of these aging in place. So I think that's often, especially for seniors, is the big problem is that they can't afford a loan. There are some reverse mortgages that is a very slippery slope that can be done well and responsibly and cannot be. And you really want to be careful. Some of the foreclosure stuff we saw with the crisis was seniors being scammed, trying to do an improvement to their house, their title getting taken. So it is an area where you really need trusted people who know what they're doing. But I would say it's mostly local.
It is. In our instance, we've had dollars at times from the city housing department where you could do wheelchair ramps for folks who needed that improvement. Someone back there mentioned energy. So there's grants sometimes from the state for energy efficiency where you can do windows and doors. But typically, it has been grants for the most part, and typically it's not a whole lot of dollars. And then when the grants have run out, then the people don't have access to those resources.
Well, I want to thank all three of our terrific panelists for the discussion today. And I want to thank all of you for your excellent questions today, and everyone who's been watching online. Also want to just thank the Bipartisan Policy Center staff who put this event together. I also want to thank particularly Jake Varn and Andy Winkler, who are the key BPC project staff who co-authored this report, so thank you to them. We at BPC are going to continue these conversations. As I tell people here, that if you really want to improve health outcomes and reduce preventable healthcare costs in this country, you need to look outside the four walls of the clinical setting, and the home and housing is a perfect place to look. So thank you for your attention, and look forward to being in touch. Thank you, everybody.